Worldwide, 5% of children and roughly 3% of adults have attention deficit hyperactivity disorder, more commonly known as ADHD. Depending on the severity of a person's ADHD, medication is one of the options to treat it. But you may see longer wait times at the pharmacy these days. Newsday Now's Dua Israr spoke to local health experts who say there's an ADHD medication shortage. Good evening, Dua.
Ken, for some people, prescriptions that took 1 or 2 weeks to fill are now taking up to nearly 4 weeks.
During the COVID-19 pandemic, one of the most common telehealth visits was for ADHD.
It's much easier to make an appointment with a physician just to be treated for attention deficit disorder.
ADHD is a chronic condition. Its symptoms include being hyperactive, impulsive, and having difficulty focusing.
I was diagnosed probably as a 13-year-old, so this would be about middle school to freshman year.
ADHD affects all ages and can be treated using medication.
I actually just got prescribed medication, so I'm waiting for it to come in.
A sharp increase for ADHD medication during the pandemic has now led to a shortage.
So there's a much higher demand and the manufacturers are unable to keep up with supply.
Nursing student Margaret Beiswanger is just one of the people nationwide struggling to get her medication.
It's difficult to obtain all three of those. Especially with changing my dosages.
Beiswanger says getting her prescription used to take 1 to 2 weeks.
But now it's more like 3 to sometimes even 4 weeks. I do stretch what I have to make it last.
Clinical manager at Gunderson Health System Mark Ertz says there are some solutions.
Could be as simple as switching strengths, a higher dose, cutting it in half, or a lower dose, doubling it to make the appropriate dose work for that patient.
Ertz says people with ADHD should fill their prescriptions sooner rather than later.
If you stay on top of it, it can be avoided.
So patients can go on with their everyday tasks.
Now, Ertz says the shortage isn't expected to last forever. He says it should ease up in the upcoming weeks. Ken?
All right, thanks very much, Dua. Health experts say if you're having difficulty filling your ADHD prescription, you should talk to your local health provider.